Hello, everyone. I am Allie Partridge. I am the Research Nurse Scientist in the Nursing Excellence Department, and I am presenting on abstract writing for conferences. So why present your work? It shows off your work, grows the profession of nursing, most importantly. Um, I think oftentimes we don't share our great work that we're doing, and uh, kind of missing out on growing that nursing knowledge. It can boost your academic and professional career. You can be a role model for others, and it shares the wealth. So you can kind of learn from each other and from others in your field. So where should you disseminate? I think it's important for you to think about, the various conferences and whether you would enjoy attending the conference, whether you're available to attend the conference, and whether you can align your work to the conference theme and tracks. So there are definitely different venues, local, regional, and national. You want to consider your audience, whether it's a specialty specific or role specific, and what type of presentation you're going to be doing. So poster presentations are really a great way to get started. You can receive feedback from others. It's really good for novice nurses or work that's still in progress. Also, there are some professional organizations that will publish your abstracts in journals to make them searchable by others, which is really a great feature. So before you begin, you really want to review the guidelines very carefully. So make sure that your topic fits the conference theme. Make sure the objectives and goals of the conference kind of fit your topic. You definitely want to pay close attention to the technical aspects also. So what are the deadlines? What is the suggested format? What is the max number of words for your abstract or for each section of the abstract? And what is the font type size and example? So this is the 2022 ANCC pathway example and their call for abstracts. Obviously, this one is very detailed compared to others, but you can kind of see they have their conference goals and topic areas, and then they have various tracks that you can submit under. I'm going to kind of go through that quickly. And then they have the headings, so purpose, relevance, significance, strategy, implementation and methods, evaluation and outcomes, and conclusions and implications for practice. But you can see they have character limits, which actually is a lot less words than you think. I think originally we were thinking it was word limit and doing it that way, and then realized, oh no, it's character limit. So these are very concise abstracts. And then you can kind of see they have all of their guidelines that they want you to follow prior to submitting your abstract to their conference. Okay, so before you submit, I would also kind of consider the reviewer's perspective. So who's going to be reviewing your abstract? Is your topic timely? Does it address an important problem? Does the author appear to have knowledge and expertise on the topic? And will the content in this abstract be well presented at their conference? Would I want to hear this presentation myself? Will this be of interest to our target audience? All right, so what is an abstract? An abstract distills and filters a project to the most basic parts. It helps you pinpoint the most essential information. Conference planners use abstracts to consider and select presentations. So an abstract explains why the work is important. It sets the context and preempts the question, so what? It describes what you are adding to the current knowledge. So the methods talk about how you did it. And it should not be a major focus of your abstract unless it's um, something related to research, where then those methodologies kind of can be a little bit more in detail. So an abstract succinctly states results, conclusions, and recommendations. So this is what most people want to know when they're reading your abstract. Tell them what you found and what you recommend specifically. Writing a good abstract is an important part of having your work accepted for presentation at a conference. An abstract also serves as a great outline for your poster. So a rule of thumb, the 4 C's of abstract writing. An abstract should be complete, it should be concise, which is really difficult to do sometimes. It should be clear, so readable, well organized, and not too complex or full of jargon. And it should be cohesive, where it flows smoothly between the parts. So starting with the title, you want your title to accurately describe your topic. It should include key elements describing the content and create immediate impression. So this is what the person is reading, the very first thing. So you need to be able to kind of grab their attention. Keep it simple, and you may want to wait till you're done writing the entire abstract and then go back and put in your title. Here are some examples at Roper St. Francis in some abstracts that were recently accepted to the ANCC conference. So what, where, how? The importance of pre-surgical education for better patient outcomes. Engaging a unit-based shared governance council to improve quality outcomes. Implementing phenobarbital for alcohol withdrawal, from interdisciplinary rounds to improved patient outcomes. Screening for meaning, engaging palliative care in the ED. So as you can kind of see, some of these catch your attention really well. Others are very clear as to what the topic is going to be about, which can kind of grab somebody's attention. Also, there are some conferences that will change your title if they don't like what you've written, but still accept your abstract. So abstract structure. Obviously, you want to follow what the conference subheadings are, but if they don't have any subheadings or you're not sure what conference you're going to present at, this is kind of the basic structure of an abstract. So it includes a background. What is the problem? The purpose, aims, or questions. Why did you do this? What was the purpose? Your methods or approach. So what did you do? The results and findings. What did you learn or discover? And conclusions and recommendations. So what does it all mean? So a little bit about the background. You want to include what the problem is you are addressing, why it's important and relevant, and what you expect or what was your hypothesis. It usually doesn't include references, so that's really true for your entire abstract. You usually don't include references. And it should relate directly to the purpose. So the purpose, aim, question could really just be a simple statement. The purpose of this study was to or is to. It could be the aim of this study or project. You could include your PICO or research question, the question that guided this project. The background should build up to what your purpose or aim is. Methods or approach. So what did you do? How did you do it? What did you measure? Research should include kind of your design, setting, sample, measurement tools, and analysis, where your project should, if it was a project, should include your setting and your team composition. Results and findings. So what did the evaluation show? What new information or data did you find? Were there any surprises? For research, you want to make sure you include your final sample size, a simple basic demographics, and primary results. And then the conclusions and discussion and what your recommendations are. So you want to relate your results to the purpose. Did you achieve your aim? And if not, why? And it's okay if you didn't achieve what you were setting out to do. It's still important that you share. What will be done differently based on your results? Who or what will be impacted? Is it safer, cheaper, more efficient, etc.? So once you have your abstract built, then you get to revise your abstract. You want to make sure you read your abstract all the way through. Read it out loud. Are there any transitions that are weird or don't sound correct? Do you need to eliminate any unnecessary content or add things that are missing? Make sure you proofread. Proofreading is very important. Confirm before you submit that you've followed all the instructions, that you've included all of the headings required, that you've used short, clear sentences, one idea per sentence, that you've limited your abstract to the word or character count specified, and have other people review it. So I'm available to review abstracts. We have several people in our nursing excellence department that would be more than happy to review your abstracts. Top 10 reasons abstracts are not selected. The title does not summarize the content. The purpose is not clear. Methods do not align with the results. It fails to report results. Significance is underdeveloped. Conclusions are not supported by the data. Implications are not supported by the data. Headings are missing. Grammatical and technical errors, and that one is probably the most common reason why, if you have grammatical and technical errors. And there's confusing jargon. So at Rubber St. Francis, we do have some templates available to us. They are available on Caroline, on the Nursing Research Council page, or in the marketing tools template. So here is the poster template. Marketing just recently updated this for us, so you can kind of see basically is your abstract just in a more visually pleasing way. If you can put your outcomes in graphs or tables, that's always better to kind of show. And then there is a presentation template available. You don't have to include all of these slides, but a lot of times when you're presenting at conferences outside, you want to kind of explain where you came from. So these kinds of these slides explain Rubber St. Francis in general. There's specifics on our hospitals and on our physician partners as well. So if you get accepted to present a podium, you want to kind of start there, delete any slides that are unnecessary to build your presentation. So next steps for you to do today. Visit your professional organization website for your specialty. Look for when your next conference is and where, and can you go to it? Look at when the call for abstracts is. Get started on writing your abstract so it is ready now. We do have a table of conferences available that we've been compiling, so you can kind of see all the different conferences by specialty, when the call for abstracts is due, and when the conference date is. So you want to make sure you're communicating this to your manager in case they need to kind of plan within their budget to be able to kind of send you to these conferences. And here are the references. I want to especially thank MUSC for sharing a lot of this content with us. And then these are our other references. Thank you very much.